This is a Guide Your Light network production, creating podcasts with purpose.
What we call autologous stem cell technology, PRP, CGF, it would just stimulate fantastic healing, reducing pain. I'm living proof that it has helped me so much. So it was well worth spending a lot of money and doing the training and getting that technology, because it gave me a connection to find someone who would treat me as I would treat others and as I would like to be treated.
Welcome to Well Worth It, a health and wellness podcast. My name is Lisa Matriste and I am your host. I am a wellness coach, vocalist, sonar, sound and energy healing practitioner, and sound healing facilitator. In 2015, at the age of 31, I was diagnosed with multiple sclerosis, a condition I was told might lead to a disability that had no cause or cure. I was given no hope of recovery. However, through countless hours of researching and choosing to take control back of my own health, I found different perspectives and found that this was simply not true. On this podcast, I will share what I have learned and implemented along the way for my health and wellness since my diagnosis that has kept me well and thriving. It is my mission to empower, inspire, and teach you how to play an active role in your health too. Investing in your own health and wellness is truly well worth it. I know this firsthand. So if you are someone who is experiencing symptoms, dealing with an unknown diagnosis, chronic illness, disease or condition, or you simply want to learn how you can get back in the driver's seat of your health, this is for you. It is my obligation to share with you that the information shared on this podcast is purely for educational purposes only. All information is based on my own personal experience and represents my opinion and the opinions of my guests. It is not intended to replace the necessary measures of your primary healthcare providers, therefore should not be taken as medical advice. Dr. Lisa Matriste is a retired Australian dentist who graduated with honours from the University of Queensland Dental School in 1986, and she is the founder of Laser and Holistic Dental in Melbourne. Dr. Lisa's interest as a dental practitioner has been for the last 30 years embracing advanced technological developments and incorporating these into holistic dentistry, creating a unique science-based approach to dentistry. Dr. Lisa promotes healthy and sustainable practices and has practiced mercury-free dentistry for over 30 years. Dr. Lisa is also the founder of Say No to Mercury. This organization is a member of the United Nations Global Mercury Partnership. Dr. Lisa uses her knowledge to lobby Australian and international governments and the World Health Organization to adopt progressive health policies that include accelerating the phase-out of mercury dental amalgam fillings. Dr. Lisa has developed clinical protocols offering health solutions that significantly benefit patients' general health and well-being beyond the conventional drill, fill, and bill approach. Dentistry has been the foundation which she has helped people to transform their lives. Dr. Matriste desires to transfer her knowledge to the next generation and beyond in this new stage of her career. In this episode, Dr. Lisa and I discuss the difference between conventional and traditional dentistry versus biological and holistic dentistry. We chat about the toxic effects of mercury amalgams, also known as silver fillings, to human health and our environment. Also, the importance of safely removing mercury amalgams. We dive into how root canals could be impacting our overall health. Dr. Lisa talks about the importance of preconception care from a dental perspective, and we also talk about how frequencies and sound therapy could enhance one's dental experience. It was an absolute honor and privilege to have this conversation with Dr. Lisa and bring awareness to many unknown dental problems and hidden dental infections that could be contributing to chronic conditions and illness. There is truly so much to take away from this episode. You'll want to get a pen and paper and take notes for this one. Let's dive in. Hello, Dr. Lisa, and welcome to the show.
Marella, it's a pleasure to meet with you again. Really looking forward to this interaction.
Oh, so am I. I'm so looking forward to this conversation. Dentistry has been part of my life from a very young age, which I'm sure has been part of many people's life from a very young age. But for me in particular, I remember going to the dentist and not really liking that experience, to be honest.
I know. It's not nice.
It's no, it's it's been one of those things where even into my adolescent years, there's been times where I really didn't want to go to my appointment, and I had anxiety around it, and even times where I needed to reschedule the appointment because I just didn't really feel like going. And there is a lot of context around that. I fortunately had the opportunity to have braces as a teenager. And, I had a lot of dental appointments. So, seeing different dentists and orthodontists and that sort of thing. And it wasn't until I was diagnosed with multiple sclerosis and started to go down the journey of my wellness path that I really opened up to another world of dentistry. So I enrolled myself into a program called the Live Disease Free program. And my health coach and mentor spoke about dental infections, hidden dental infections. And it was at that point where I actually started to realize that there was a whole other world to dentistry. And so, that took me down a path of learning about holistic and biological dentistry. And I'm just so grateful to be able to have this conversation with you today, because I truly believe there is not much education around this type of dentistry. And before we get into all the amazing topics, I was, getting ready for this episode and this conversation, and there was just so many topics that I really wanted to touch on. I would really love for you to share your journey and what led you to become a holistic and biological dentist.
Yes. Oh, Morella, first of all, the anxieties that essentially it's more than 80% of patients would rather avoid the dentist. And as a consequence of that, dental disease can perpetuate. And then by the time they develop a significant problem, there's usually some irreversible damage there. So one of the key motivators for me when I became a dentist was I wanted to deliver dentistry in a gentle way. In fact, one of my first practices I called the Gentle Dental Group, and I was definitely emphasizing the femininity and the gentle touch. So when I first became a dentist, I worked 2 years in the school dental service up in far north Queensland. And then at a very young age, I bought my first dental practice, and everything was pink. And I was considered a bit of a freak because, we're talking almost 40 years ago. And they would say, "Oh, I've never had a woman work on me." And so there was this layer of education that I needed to do. And when people are anxious about going to the dentist, if there's a new thing, such as being a woman or a new procedure, it just builds up that extra layer of anxiety that we have to work very, very hard to rectify. So this is, again, touching in with your sound therapy, because I believe that is a very important resource that should be integrated into the dental experience. So my background was essentially, I always loved helping people. I was probably destined to be a nurse, and that was definitely encouraged within my family, that we had the gifts of looking after and caring for people. I came from a very loving household, and giving and serving others was considered to be a significant life purpose. However, I was I excelled quite well academically. And then I believe that, as my parents would tell the story, in 1975, there was a change of government, and I had a very poor upbringing, but nevertheless very simple foundations and very loving. And the barriers to getting a professional education came down with the change of government by a Labor government in 1975. So that was the pathway for the five girls. So I've got four sisters. We all pursued health professional careers. And I actually wanted to be a doctor, and I just missed out. And my mum said, Lisa, I want you to be a dentist because we've got a doctor already, we've got a physio, we've got, virtually all of the health sciences were covered. But she said, I want you to be a dentist. So I was a very obedient daughter and I became a dentist. And you don't, and I did suffer the disappointment. I think I cried when I realized that I just missed out. But I now realize that dentistry is a phenomenal healing science. And even though it's not taught in that way, it's very, at the university level, they separate what's going on here with the rest of the body. And this is why I embraced the genre of holistic. Meaning that there is an interconnection between what goes on here and your overall body, but also it also goes in reverse. So your mouth represents every single type of tissue, and so what's happening with your connective tissue, what's happening with your bone levels, what's happening with your hard tissue, your blood supply. It's an indication of what else is happening systemically. So that's kind of a nutshell of how I became a dentist. And I wanted to heal people. And even though I couldn't do it as an official medical doctor, I was just naturally drawn to learning how can I make my patients' lives better and their families by improving the way that I practice and the technologies that I use. So that's been the primary motivator behind my professional journey.
Wow, thank you so much for sharing that. And I just love the fact that you started off your journey with a pink clinic. I would really love to
Yes.
see images of that if you have them. That is amazing.
Yeah, I wasn't aware. So this was before the Barbie movie by Robbie. But
Yeah.
my sister was in she was in Mackay. I was based up in Cairns in North Queensland. And she calls me up. She said, "Oh, I hear you've got a pink autoclave." And I went, "What?" And so it had filtered out amongst the medical work about this eccentric young female dentist up in North Queensland. Yeah.
Oh, wow. And I must say, I'm so grateful that you did become a dentist because when I was on my journey, part of, going down that new whole new world approach to
Mm.
dentistry was looking for a dental clinic that offered these services. And it was through my research that, laser and holistic dental was recommended. And that's how I came across
Yes.
your beautiful clinic. And I must say, my experience with your clinic has been absolutely amazing. I no longer fear going to the dentist. I
Very
actually
good.
enjoy coming in.
Very good.
And I remember, my first consultation, I came in and I had an appointment with the dentist and, we spoke about my health history. And I've
Yes.
never done
Yeah.
that before. And I was like,
Hmm.
wow,
It's
this
all
is
just
such,
limited here. Yeah.
yeah, this is such a different approach. And,
Mm.
even having the appointment itself, I had lip balm put on my lips and, my
Yeah.
jaw was checked. And
Natural.
yes, natural. Everything was natural. And,
That's
I was,
right.
being very mindful of that as well. And so, it was a whole new experience for me. And as I said, something that I had never heard of before.
Mm.
So I would really love for you to share what the difference is between conventional, traditional dentistry, for example,
Mm.
and biological and holistic dentistry, especially for anyone that hasn't heard about that before.
Mm. Super question. And this is a very important point for the audience to grasp the differences and approach in managing dental disease. So when I first came to Melbourne from North Queensland, and that's almost about 20 years ago, and I'm putting together my advertising, and I wanted to call myself a biological dentist because this is the term that's used overseas. However, no one in Australia was known as a biological dentist, and now the general population would have no idea what it was. But we've now got the fantastic access to information through the internet, so you can type in biological dentist. So Australians are more comfortable, I think, with the term holistic. Now, the points of difference between conventional dentistry and holistic or biological is that, and I alluded to this in the opening. We do respect the impact and the effect of what's happening in this connection between the oral health and your overall health. So that's would be the first thing. Holistic also has a connection with body, mind, spirit, and whereas biological doesn't really recognize that, it's more science based. Now, when I was practicing as a dentist, we are under certain regulations and there is a code of conduct. So even though personally and you can see I've always loved crystals, and I've got thing and I was naturally drawn to that. I was probably I think I had the honour of being the first dentist in Australia with acupuncture training. I was looking at ancient sciences, ancient forms of healing, but also combining it with the latest medical research and technology. For example, my attraction to lasers, the healing power of light. I've loved rainbows. I just love, seeing the sunshine come through a window or a prism. Now, lasers are exactly the same. All right, they transmit light through a specific crystal, and from that crystal will come a certain wavelength. So there's been this, I guess it's a fusion between these ancient and tested healing practices and combining it with, the what science can give us. And I believe that synergy, when you bring it together and you get, the best healing response that is currently available. Now, conventional dentistry has very little regard for biocompatibility. They don't care, and it's still, 40% of Australian dentists are still putting in dental amalgam, which contains 50% mercury. There's hardly any reference to environmental impacts, such as the wide-scale use of fluoridating our water supplies and the impacts that this has. It essentially comes down to, in the selection of dental materials, does it look okay, and will it stay, is it strong enough? And with no regard as to how that's going to affect the person that it's in, how this is going to affect the dental workers by using these materials, and what's going to be the impact of this material, such as the excretion, so your urination, everything that goes out into the sewer, whether you spit or whatever, get cremated, get buried. What is going to be the long-term impact of you having certain materials within your body? And let's not forget the importance of preconception care, because what is in the mother, very many of the dental materials, especially mercury, will pass through the placental barrier and affect your child. And also for the men, particularly again, the mercury, it concentrates in the testicular scrotum. It has an impact on sperm levels. It will drop them severely. So, I think about these things, and what I've done at Laser and Holistic Dental was that I reviewed every single dental practice. I read all the labels, and then I worked out, what can I do? How can I deliver this service that it will respect those principles of, is it good for me? Is it good for others? Is it going to be good for our planet? So I've scrutinized that, and there would be very, very few people that have consistently gone through and done that. Plus, you've got to be able to scientifically validate that these materials and these products and these processes are going to meet the same standard as what's happening in mainstream dentistry. So I take on that challenge, and I didn't want just to reproduce mainstream dentistry. I want to take it to the next level. And that's what
Wow.
I've worked at Laser and Holistic Dental.
Yeah, wow, that's absolutely amazing. And I think a lot of these things people aren't aware of. I know I certainly wasn't
Yes.
aware of them. I had many
Mm.
mercury amalgam fillings and I had them removed as well. So when I actually came across, the holistic and biological dentistry and learned that, there is actually needs to be a safe removal
Absolutely.
of these fillings in our mouth. So, for some people out
Yeah.
there, you may know these as silver fillings.
Mm.
And, you need to have a safe removal around these. And I remember when I came across this and I was like, oh my goodness, I actually didn't even know when I had mine removed. I don't know if they were
Yeah.
removed safely. And I started getting into this really stressful state of like, oh my goodness, I don't know whether I've been exposed to this. And so
Mm.
I went down a journey to try and find out so much information around, what I had done in my past. And unfortunately, I wasn't able to get the answers that I needed.
Yeah.
However, I looked at it from an approach of, okay, I'm not going to worry about this. It's already happened, it was out of my control. I
Mm.
started fresh, and then that's when I came across to your clinic. But
Yeah.
before doing that, I also worked with a naturopath, and we did a lot of
Yes.
testing around heavy metals. And
Yeah.
so I knew roughly what I was actually dealing with in terms of like heavy metal toxicities and that sort of thing.
Mm.
So I'd really love for you to share and dive deeper into mercury amalgam fillings, or silver fillings in particular, and really
Mm.
talk about what the toxic effects are of these and what people could be experiencing as symptoms, and
Mm.
how does this actually affect human health and our environment.
Yes. Very big questions, very important questions, Morella. So I would start from the very beginning, which is your first exposure to mercury will be when your mother is pregnant with you. And if she has got dental amalgam fillings, the mercury from that is constantly vaporizing. You chew it off. So you actually find in stool samples all this little shred bits of dental amalgam. And as I said, it's got 50% mercury in that. So the other thing is you get exposed there. Then, as you are born, you might have exposure to mercury thimerosal vaccinations. Then, if your dentist says, "Oh, I'm going to put in silver fillings," it's mercury. So in your baby teeth, and then as your adult teeth come through. And what happens, and particularly in certain individuals who are what are called metal sensitive, so they've got a genetic predisposition that if they get exposed to even small amounts of metals, and they're called transition metals, and mercury is but one of them, titanium's another one, nickel is another one. For example, if you're wearing earrings, um, you will develop an autoimmune reaction. And you did share with me about your multiple sclerosis, and that is an autoimmune disease. And being exposed to mercury and other metals is definitely a trigger. Now, so this is the pathway. And even WHO said back in 1991, in a country that practices mercury-based dentistry, and that's essentially all of them until recently. But Australia is definitely a very resistant one to change, to stop practicing mercury-based dentistry. Your greatest exposure to mercury will be from dentistry. Without it's black and white. It's not the amount of fish that you consume. All right, it's dentistry, and so this is part of the opportunity that we've got of this awareness through your podcast and what's on the internet now, uh, is getting access to that information. Now, I think your other question was talking about the environment. Um,
Yes,
so
that's
the
right.
dent, so the dental sector, not only are they putting it into people, but the removal process. Now, these amalgams have been traditionally said they are cheap and they last a long time. The reality is, yes, the filling does last a long time, but your tooth will die around it. So it will, for the metal expands, contracts every time you have something hot, cold to drink. And then you get these nasty fractures, particularly in your molar teeth, and a corner of your tooth will come off. Now, that's not because you didn't brush your teeth. That's not because you have got decay. That is purely because when you were younger, you had an amalgam filling go into that tooth rather than a white filling. And then the cycle happens. You'll need a root canal because the fracture line's there. Plus, the metal conducts a lot of heat. It's electrically active. And so there's a lot of nerve trauma that happens in the pulp of the tooth. And I brought along my little prop book here.
Oh, I love that.
Ta-da! All right. So you have, so you have this, the filling will cut down here. But this is your living tissue, blood, lymphatics, and nerve tissue. And the heat and the hot and cold cause these thermal contractions and expansion, but also the because it's an alloy, there's constantly electrical activity and exchange happening between the elements, and it causes migration of the particles down into this area, and the body is trying to resist all of these forces. And then if you've got an amalgam touching another metal filling, it's just a massive circuit that happens. And it has been measured. I used to measure it in people, and it causes the brain fog, and it causes your processing, your neurological processing to actually work really, really hard because you've got all these electrical currents. And then if you've got metallic braces as well, it's a massive electrical storm in there. So with the removal, so one day you will have to present to a dentist because you'll lose a cusp on a tooth, which is a corner, or there's been the nerve inside has got really irritated. That's called pulpitis. And then the dentist will have to, as in your experience, remove it. Now, what happens as that dentist puts the drill on that amalgam, there's massive microscopic particles and of mercury and it's 0.6 of a micron of the particles, and that will be directly inhaled. The gas within 20 seconds is lodged in the frontal lobe of your brain, and this is why it is exceptionally important that if a dental amalgam does need to be replaced, you must find a practitioner that has got SMART certified. Now, I was, and Laser and Holistic Dental was the first clinic in Australia to get that qualification. And what that means is that we are caring for the patient by having the appropriate barriers, alternative air supply. We've got I look after my staff, so I've designed the clinic so that we've got exhaust fans, very expensive ventilation capture devices, and so it either goes up in the air, which you will all breathe, or it gets sucked up through the suction, and then it will go out into the wastewater system. So this is where you should install an appropriate device to try and capture that before it goes into the water system, and then that gets disposed as hazardous waste. On that topic, I am constantly dumbfounded why we are still using, in modern dentistry, this primitive, polluting and poisonous product. It was invented more than 200 years ago, 1819, I think it was. So we're still using it, and we've got access to really good-looking alternatives. But I remember the times that when I go to lobby governments, I actually take along an extracted tooth that's got an amalgam in it. I carry this little bottle with me, and I say, you see that? You see this bottle? In fact, I should have brought it down to scare all your audience. I said, it is classified as being safe when it is in a human mouth. But the moment The moment that mercury leaves that filling, whether it's being drilled out or whether you're extracting that tooth, it is classified as a highly hazardous, dangerous material. And then there's a whole regulatory pathway of how you should deal with that extracted tooth. But yet, it's allowed every day. Millions and millions of people, young and old, are having more and more put into it. So it's not good.
No, it's definitely not good. And thank you so much for sharing that. I think, the first thing I want to say is congratulations on being the first dentist to be certified in SMART, and also your clinic. I think that's such an amazing achievement and movement as well. And, for anybody listening, today is more about, sharing this to raise awareness. And, I know for me, I was stressed about it and worried about it, but it is about, taking that first step and then educating yourself around it, and then finding those around you that can work with you to do it safely. So thank you so much for sharing that, Dr. Lisa. I'm, feel very privileged to be able to have this conversation with you. You are so knowledgeable, and I just love that you're sharing your wisdom with us today. Now, the other thing I'd love to talk about is root canals, because that's another procedure. You've mentioned a little bit about that, but I know for me personally, I'm currently going through a phase where, I've had 2 root canals, and I didn't know any information about root canals before I had them. And again, looking into this and now researching it and understanding that, having a root canal can actually host bacteria in your system, and that then this can leak into your body. There's even been studies around breast cancer linked to root canals. And, for me personally, I'm going down the path. I mentioned to you that I have been resistant to removing my root canals, but the more I research and the more I learn about it, the more I know I need to remove them. So it's also great to know, there are other ways to replace these teeth. I know for me, I'm very conscious about replacing any teeth that you need to remove, and knowing that there is a ceramic option out there that is biocompatible with your body is such a great thing to be able to have access to. But from a root canal perspective, I would really love to share how these can actually impact your overall health. And, is there a connection to breast cancer? What's your perspective on this?
Yeah. So root canals are, they've been around for quite some time, over 100 years. And what a root canal is when the tooth actually dies. So let's go back to that little diagram of what the normal anatomy of a tooth should be. So this inner aspect, so your teeth are like hollow chambers. They're hard on the outside, they're soft in the middle. And a tooth can die from trauma, such as if you get hit, and it might take a while to die. I've had patients over 20 years after a hockey stick accident or whatever. But the tooth will die. It will also get dyed if it's constantly getting injured, and that happens if you keep on getting fillings replaced because there's the decay under it hasn't been arrested. But when this dies, it actually necroses and it's gangrenous. Okay? Now, this is an oversimplification of what a tooth looks like. The reality of the internal structure of a tooth, I want you to think about when you go gardening and you're going to go weeding, and you're going to pull that weed out of the garden. Does it just have a single root going down? No, it can track everywhere. So when you actually look at the anatomy of a tooth under a microscope, there's probably millions of little tiny blood vessels, and the nerve and the lymph. It's this what we call a microvasculature, and it goes everywhere. So when root canals started coming about, it's like, we are going to maintain the structure of the tooth that you can chew and function on, and then but it loses its blood supply. It loses all of the living component to it. So you're left with something dead living in a human body. All right. Now, you want to think of it as a skeleton inside. So that tooth is now a skeleton. It's got no blood supply. It's got no sensation. And so what the dentist does, they go in and they try and remove the main canals, but they will never ever get into those microvascular systems. So they continue to be necrotic and you can't clean those out. Now, at Laser and Holistic Dental, for the patients that choose not to, if they choose not to have the tooth extracted, they do want to keep it. We have got certain laser techniques which help to irrigate. It's not perfect, but it's for those people who are too scared to have an extraction, or, for example, you have to assess everybody's case separately, and it's the job of the dentist to actually give a balanced perspective and say, all right, this is what we can do. These are the risks. These are the benefits. If you're going to have it out, then we have to talk about how we're going to fill the gap. There's a conversation that needs to be had. But you might have a patient that will prefer to get a molar root canal removed, but they'll get their front tooth done. And I've certainly done that in like a growing child. She was 13, trauma accident. You can't. It's best to keep, I believe, in that circumstance, that particular tooth, but do the root canal using lasers and using best available materials as possible. So what happens is that you've still got all this micronecrotic material. Plus, if you ever did have an abscess in that tooth, there is residual microorganisms. One of the microbes that the research scientists use to test whether a root filling material or process has succeeded or failed, they test for a microorganism called Enterococcus faecalis, as in feces, faecalis. We also know that these microorganisms, because now they've got very sophisticated DNA typing, they are able to see problems in joints, on prosthetic valves. They can test when these sites get infected, they can test the source, and it's an oral pathogen. We also know that residual infections around root canals can seed on the heart and other areas. So it's not only the residual bacteria, it's not only the source of untreated necrotic tissue, but it's also the materials that are used within a root canal. So conventional mainstream dentistry will use a latex substance called gutta perca to fill up those chambers. They glue that in with formaldehyde. It's a cement that's got silver and formaldehyde in it, and it pickles the bone around the roots. So that coat also becomes necrotic and what we call avascular. And the nerve supply also that used to go up inside the tooth, it's kind of amputated at the base of the root tip. And the formaldehyde will have some effect on that nerve. So this is why there's a practice that if you do have a root canal, you've got to take x-rays fairly often to check on the nature of the infection. Is it going to blow up? And when you use this formaldehyde, you can have very silent infections just growing and growing and growing, and you wouldn't know about it. And I think that's one of the factors of the impact of the formaldehyde. They can be quite destructive. And then, as I said, they can be a trigger for the seeding of microorganisms in other parts of the body. I was reviewing the position statement of the United States of America Endodontology Society, and there's even, and you might want to Google that, but there is a connection between blood disorders. So there is definitely, the science is out there that there can be systemic complications from having a root canal. But again, you've got to find people that are at least aware of this and who will respect your preferences as to whether you want to keep the tooth at all cost or whether you want to have a very definitive solution, which is the extraction of that particular root filling.
Thank you so much for that. And do you think there is also, based on your experience and knowledge, whether there's a connection to breast cancer as well through that, or?
I I certainly saw the scientific papers, and one of my colleagues has just sent me another paper this week about a very large scale study done looking at root canals and another health disorder. I can't remember it offhand.
Okay.
What I can tell you though is, as a dentist who extracted a lot of these, they stink.
Mm,
They really, really stink. So when we pull them out, they're black, slimy. Um,
that's not a good sign.
no, it's not. And so there is this. I remember one case on an X-ray looked perfect, but he wanted it out because of health reasons, even though he was well, but he was being very proactive in his health. And when I actually used the faucets and removed it, there was a massive, massive release of noxious gas into the dental clinic. And it was so bad, we had to evacuate. The patient
Oh,
was
goodness.
sedated. We brought in all the air chambers. So this was the worst case scenario where you've got a gold crown over a mercury amalgam core and in a root filling. So there's a reservoir, and the roots were all black, and I pulled that out. So there's a particular endotoxin, neurotoxin that is connected, and it's got a formula similar to mustard gas or something. But for me, that was a massive awakening that you don't really know what they're doing. And this looked absolutely perfect on an X-ray. And I counseled him. I said, look, I will do this electively and I will do it because you have requested, and I will take very good care of you. But on all the tests, I cannot see anything indicating that there's residual infection. But that was a real learning lesson for me. Yeah, again, it can't be good, harboring that inside of you. Yeah, for
Absolutely.
decades.
And I guess, that's why they're considered hidden dental infections, because I know
Exactly. Yeah.
for myself as well, when I came to your clinic, I did have the 3D cone x-ray done.
Yes. Yep.
And thankfully, that showed, that everything was okay. But
Mm.
I also had the laser treatment, the laser clean treatment, and I have them periodically as well.
Mm.
So, but yeah, the reality is you just don't know, which is,
No. No.
yeah,
No.
it's one of those
No.
things. I
Mm.
spoke about parasites in one of my last episodes, and doing stool testing around that, and which showed negative results. But then when I actually treated myself with parasites, I actually did have
Yeah.
parasites. So it's another one of those things that you really need to look at your dental work and
Definitely.
other things in the body
Mm.
in order to get into a recovery and healing state. But I also wanted just to touch on, you mentioned the nerves in the teeth, and you also mentioned you did your acupressure training.
Yeah.
And through my research, and also, I love reading, and I'm very passionate about health and wellness because obviously of my journey. But through reading a lot around dentistry, and especially holistic and biological dentistry, they talk about the meridian system and
Yes.
how these
Yeah.
nerves are connected to different organs in our body and how it can
Mm.
actually affect different things in our body. Someone could
Mm.
experience, pain in their knee that actually could be connected to their tooth. So
Yes.
I guess, so would you say that's, in your experience, have you seen those type of scenarios in terms of, any clients that have come in where you've removed teeth and they've had full recovery of their illness and that sort of thing?
Yeah, definitely. What comes to mind is particularly with cardiac health. Uh, so one patient came to see me, um, and he had just recently, he ended up in emergency. He ended up having arrhythmias and things like that. Now, I hadn't seen him for a number of years, but he told when he did track me down, he said, "I've just had a root canal done at another clinic, and I reckon it's caused my heart problems." So, as when I was a dentist, you and I'll go back to the code of conduct. We are not able to say this tooth is causing this problem, and therefore, if I extract that tooth or do a procedure, your problem will get away. That will never happen. We will never ever be able to say that would be considered to be a breach. Okay. So, respecting the acupuncture charts of meridians, no dentist will ever make diagnosis based on those meridians. How I used to approach this is that if a patient, oh, by the way, that patient got better when I pulled out his tooth, actually, within a week, everything, and he even went back.
Wow.
And he had the ECGs done, everything had returned to normal.
Wow.
Okay. So, if you have your own intuition, and I'm a big believer in respecting that and finding a practitioner who will not use professional bullying tactics. And I've had terrible stories come through in my career, how they'll say, I had this mother, she told the dentist, I do not want my 3-year-old to have an amalgam. And when the child comes out, he's got a silver filling and an amalgam. So, I've come across that. So trust your intuition. Going back to the meridians, I personally believe in these things. I think there's also a map of the ear, the foot, there's the mouth as well, the teeth there. If another health professional, albeit a naturopath or whatever, says, there's a connection here and you want to explore it, then I think, this is what we call your personal preference. And you've got to have your opinion respected. And then you go through the conversation of saying, okay, well, if you want me to pull out this tooth, you need to be aware that your symptoms and your problem may not go away. You have to take that risk. And then if you say, yes, I'm prepared to take that risk, then we can go forward with the procedure. Yeah, but you've got to be well informed about making irreversible decisions, such as having a tooth extracted or other things.
Thank you so much for sharing that. And I'd also like to touch on, you mentioned before, preconception care. So I've had a special interest around this probably since last year now, and I enrolled myself into a holistic mama program just to learn more about preconception. And part of that journey was, learning about toxicities in the body and nutritional deficiencies and how to rectify that. But I guess from a dental perspective, you did mention how you can actually pass on these things to the baby while they're growing.
Absolutely.
Yeah. So I guess from your perspective, I'd like to ask, what would you recommend, someone who would like to conceive a child, what would you recommend they do in terms of, both partners, if they do have mercury fillings or, what would you recommend they do?
You need to dedicate a good year before you have a baby. Seriously, but it's worth the time and it's worth the investment of becoming dentally fit. Two reasons. The first is not only the transfer of the biomaterials that are permanently implanted into your mouth, but it's also the microorganisms. And you're also going to have that baby, and hopefully you'll breastfeed for maybe 2 years. And so it's you want to think about it's a 3-year time frame in setting up that baby for the rest of its life. And the breastfeeding helps with the shape of the jaws and so forth. But you can also be transmitting, if you've got amalgams, you will be passing through the mercury through the breast milk. It's as simple as that. So you need to, the other thing is if you don't deal with having biocompatible materials, if you don't deal with the existing infections and particularly periodontal disease or bleeding gums, this will definitely worsen from the hormonal influences of pregnancy. So it needs to all be cleaned up. Identifying whether you've got unerupted wisdom teeth. They will flare up during pregnancy. So, and I've been in this situation where the pregnant lady's out here, she's tried to keep herself really clean, chemically free, and we've got to do oral surgery on her, got to give her antibiotics. It's such a compromised situation because you're thinking of two lives there. And with good planning, this should have been addressed before conception. All right. So these are the things that typically will manifest. Plus, with if you've got untreated dental decay, the primary pathogen there is Streptococcus mutans. Periodontal disease is a different type of microflora biofilms. But you need to have your mouth really clean because you will transmit and inoculate your baby with your oral biome. And if it's pathogenic, we will see pediatric caries. And again, we're seeing a rise of this as well in the populations that, the breastfed babies, very health conscious parents, and yet the baby teeth are already rotting. So the primary carers of the baby, the mother, the father, probably grandparents as well, they need to be dentally fit so that you can eliminate all the risk from these pathways. The other very important vulnerable population that benefits from being declared dentally fit are the patients, sadly, who have to go through chemotherapy or they are going to be prescribed bisphosphonate medication for osteoporotic bones. These patients need to have their mouths really, really clean, full dental revision, because taking these pharmaceutical drugs alters things. And if there is a flare-up of infections, as a dentist, we may not be able to treat them. And I've been in that situation, sadly, where root canal, upper molar. Lady had diagnosed with breast cancer. It started to disseminate into the bones and put on chemo, whammo. Root canal, big abscess, whopping, terrible, terrible, severe pain. The pain from the dental abscess was worse than what was happening in her bones. And I couldn't treat her. She died terrible, painful death. I couldn't treat her because she would have bled to death because the chemo, her immune system had been all knocked out because of the chemo, and the alteration, she had no clotting capacity. I hated being in that position of not being able to help her. So, yeah, listen, spread the word. You've got to get cleaned up, dentally fit. Life will be a lot better for you, and those around you.
Thank you so much for sharing that, and sorry that you had to experience that as well. I think, it is so important to know this information. I'm also studying integrative health, and one of the things is that looking at underlying root causes and, doing heavy metal detoxes and that sort of thing. But I think the reality is that you really need to remove the source before you do any of that.
Absolutely.
Because it's just going to keep on leaking through into your body. So Absolutely. It is important to share this information. But yeah, thank you very much once again for sharing that. And there's so many things I'd love to chat to you about, and I know that we are running out of time, but one of the things that I'd really love to just touch on is sound therapy. So you did mention this briefly at the beginning of this episode, and I know you've had amazing experiences with sound healing.
I have.
But from a dental perspective, you mentioned, incorporating this in this space. What does that look like?
Absolutely.
What do you envision around this?
For example, having your dental experience, it's a very hostile environment, and you've talked about your anxieties, and it's so common. I mean, I don't like going to the dentist either, and I was doing it for 40 years. But we are exposed to that sound of the drill, the ultrasonic, compressors. There's a lot of noise that's going on. So definitely for the patients, I always recommend for them, if they can be listening to something that is soothing. And for example, we've got this technology now, so coming in with that, but we've also got a capacity to heal on an emotional level as well. And I'll touch briefly about the use of nitrous oxide, or what we call relative analgesia. So relative analgesia is where you have a mask and you're breathing it in. Now, it opens up your subconscious to positive suggestion. Now, we use it at the practice to help relax, but I take it a step further. It's actually a healing opportunity that if you are listening to certain things, you can, and certain messages, whether it's meditation or your healing frequencies, in combination with the happy gas, it will go a deeper level. And in my experience, when I was practicing, I would have people, not only did they have the dental anxiety, but there was deeper trauma that they had experienced. And it does come up, even though we don't get an opportunity to talk much in the dental environment. And so I would love for patients to embrace that opportunity. And also, Morella, the beautiful work that you do, if there's, I would open up my clinic if there was going to be some combined management of you coming in and assisting patients in their healing journey, because there is definitely a lot of trauma that happens. It's not always dental, but it is an opportunity, and people don't think of dentistry as being a way that you can transform your life way beyond just having a cute smile and good breath. We can do these other wonderful things for you as well.
I would absolutely love to explore that further with you, Dr. Lisa. So keep tuned, everybody.
You're on.
And so the next question I'd like to ask you is based on the name of this podcast, which is Well Worth It. And I'd really love for you to share something that you've implemented in or invested in for your health and wellness, which has been well worth it.
There are so many things, but if anybody knows of my history, I haven't been able to work as a clinical dentist now for almost 3 years. And that's part because I've worked as a dentist. So I lost the capacity to use my arms, and particularly my hands and my shoulder. And what I'm just getting better and better, but it is taking time. But one of the benefits of having what we call autologous stem cell technology, PRP, CGF, I actually introduced that into my clinic over 10 years ago in order to, so this is where you have some blood taken and then you spin it. And then in my oral surgery protocols, I would implant it in, and it would just stimulate fantastic healing, reducing pain. So I was doing that, but independently with my injuries, fortunately I found a medical specialist who is an expert in this area. So I have benefited from that technology. So I had an awareness very early on in order to help others. But as it turned out, I'm living proof that it has helped me so much. So it was well worth spending a lot of money and doing the training and getting that technology, because it gave me a connection to find someone who would treat me as I would treat others and as I would like to be treated. So I felt really, really blessed, and it was well worth it.
Wow, I absolutely love that, Dr. Lisa. Thank you so much. It has been an absolute pleasure having this conversation with you. You do such amazing work. And as I said, I feel so privileged to have met you and to have had this conversation with you. I'd really love to know what we can do to support the work that you do, because you are also the founder of Say No to Mercury. So I know,
Yes.
and I know you're off to Geneva shortly to lobby for Australians and others around the world in terms of mercury. So what can we do for you?
Oh, well, thank you. I've never been asked that question. What you can do for me, it's awareness raising. And what is happening? So we're going, so 4 years ago, I was working with some other NGOs, rallying up global support. We needed 2/3 of the world's countries to decide to ban dental amalgam. It was quite shattering watching such a positive and timely health message just get diluted, get deferred, but it's back on the agenda. We've had more and more countries, because we are the voice. So Say No to Mercury and some other international organizations, we are the voice for saying, it's had its time. It's done its damage. It's time to stop. There is no justification for the continued use of dental amalgam. So you've got to look after yourself first, and then you can look after others. So spread the word.
Thank you so much. We're right behind you and supporting all the work that you do.
Thank you very much.
I definitely know I am. And how can others connect with you? I know you have your beautiful clinic, Laser and Holistic Dental. It is such a beautiful practice. You even have a beautiful piano in the front
I do.
room.
Good sound therapy. I need to practice.
my husband, the first appointment we came to, my husband really wanted to play the piano because he's a
Please do next time. Go for it.
I will bring him in to play it next time.
Look forward to it.
How can people connect with you and reach out to you?
Okay, well, again, it's via the clinic. However, I am retired, and I do come into the clinic from time to time. But it's very important that what I've learnt, I'm instilling that into the new generation of dentists and also all the staff there. And so directly contacting me is not going to be easy, but I do pop up from time to time to get involved where I can, given my physical limitations. But definitely at Laser and Holistic Dental in South Yarra, and I've got a wonderful manager there and all the staff. Things can definitely filter through to me to get my attention.
Thank you so much. I am so looked after by your beautiful team, and just truly grateful, that the knowledge that you have has been instilled in your staff as well. So thank you so much for joining me. Thank you very much for spending this time with me, and I'm sure we will have many more other conversations, because
I look forward to that. Yeah.
There is so much that I really wanted to chat to you about, and I think we've gotten through a lot of the things that I wanted to get through today. So thank you so much once again. Wishing you all the best on your trip, and yes.
Thank you, Miranda.
Thank you.
Thanks for listening to this episode. Life is all about the choices we make.
You can choose to take control and look after your health and wellness. Choose to love, choose to surround yourself with amazing people, choose to be grateful, and choose to be mindful and kind, as you never know what someone else may be going through. Choose to live a beautiful life. Remember, the choice is always yours. Has this episode planted a seed or sparked some curiosity in you? Let's keep the conversation going. Join our @wellworthit.podcast Instagram community page, or stay in touch via my personal page @morella.petrucci, and be the first to know about new holistic offerings I have coming up. Also, please show some love by rating and reviewing this podcast on your favorite listening app. To your health and wellness. Until next time.
This is a Guide Your Light Network production, creating podcasts with purpose.